Hello everyone, I am Jolil Mamasaunda and I am gonna be performing arterial blood gas extraction. An arterial blood gases ABG test measures the acidity, pH, and the levels of oxygen and carbon dioxide in the blood from an artery. This test is used to find out how well your lungs are able to move oxygen into the blood and remove carbon dioxide from the blood. Also, an ABG test requires that a small volume of blood that can be drawn from the radial, brachial, and femoral artery with a syringe and a thin needle. So the very first thing to do is read the doctor's order. This is to verify and obtain pertinent data. So the next thing to do is hand washing. Assuming that I have already washed my hands, this is to deter or lessen the spread of microorganisms on the surface. So the next step is to gather all the required equipments. So assuming these are my real equipments, so this is syringe, my heparin, tape, surgical or medical gloves, extra needles, alcohol swab, and cotton balls. So the next step is to select the site. You may use the radial, brachial, and femoral artery, but we are going to select the radial artery since this is the most common site for ABG extraction. Then, the next step is to perform Allen's test, and this test is to promote collateral circulation of blood by asking the patient to make a tight fist for about 30 seconds and have the patient open their hand and slowly release the ulnar artery. Assuming that the hand turned into pink is a sign of correct Allen's test. Next is prepare the site and fingers used to palpate. Next is cleanse the site with povidone iodine prep swabs or alcohol swabs. In circular motion and then allow to dry. Prior to that is to heparinize syringe and needle by injecting the syringe into the heparin, then discard the needle after. Next is to perform puncture on the selected artery by locating the pulsating artery and puncture at approximately 45 to 60 degrees angle. And then obtain 1 to 3 ml of specimen. And then apply pressure with cotton and tape. And lastly is provide chart information. So that's all. Thank you.